Hi, everyone, and thank you very much for joining us in today's webinar. And today we're going to discuss about powering the next generation of symptoms checkers with video-based remote vital signs monitoring. As always in our webinar, please feel free to ask any questions you might have during the webinar in the Q&A sections, and we will be more than happy to answer any questions, whether it's during the session itself or after the session. We're going to have a Q&A section, so please feel free to write down any Q&A questions that you might have. So again, I would like to thank each and every one of you for joining us today. And we are Bina AI. It's just going to be one slide. It's not going to be a sales presentation. So we are truly focused on actually talking about the subject we're focusing on. We have over 100 customers worldwide, already supporting 7 out of the top 100 insurance companies in the world that use our technology in production. And we're going to talk a little bit more about Bina at the end of the presentation. So in this today's agenda, we're going to talk about what are symptom checkers. And we're seeing this kind of an evolution where symptoms checkers are actually starting to take over, I guess we can call it the virtual nurse. How a nurse actions that are being done before you're actually seeing the doctor, asking you the right questions, starting to understand the full story about how come you're visiting the physician, and which kind of actually added information she can retrieve in order to make the doctor's work much more efficient. So I guess when symptoms checkers, everything starts with doctor internet, how people are actually Googling or Binging, we can say, more additional information in order to understand more about the situation there are and whether they should actually see a doctor or not. So we're going to talk a little bit about how they increase the efficiency of those kind of symptom checkers and how additional health data dramatically changes the way of observing a person in order to take a specific decision. And goes without saying, the multiple use cases of symptoms checker. The majority of symptoms checker, there are Q&A, and let's just move on and roll in. So what is an online symptom checker? So as I said just a minute earlier, everything is evolving to have the ability to ask you the right questions, whether in order to direct you in the right direction, or whether it's about having the ability to actually take a specific decision. From what we've seen today, the majority of symptoms checkers are actually exempt from FDA approval, which means this is not a medical decision maker. When we're trying to see the definition of online symptom checkers, I guess we can break it down that online symptom checkers are calculators that ask users to input details about their signs and symptoms of sickness, along with their gender, age, and location. Using computerized algorithms, the self-diagnosis tool will then give a range of conditions that might fit the problems a user is experiencing. As time passes, we see that symptoms checkers are actually much more aligned for a specific purpose, whether to decide how critical your telehealth session is important, whether it's about having the ability to provide you the option to actually start a discussion with a physician, and sometimes even to take a much more, I guess we can call it in-depth decision about the ability to define a specific situation in case you are in the current situation. When going through symptoms checkers, doctor internet to patient triage, I guess we can talk about the specific purposes of the specific symptom checkers we see today online. So I guess when it comes to facilitate the self-diagnosis, everything starts with the ability that comes to the understanding that a person actually knows how he's feeling. In a few minutes, we'll go through a deeper and to see how organizations have actually evaluated the accuracy, the correlation, the sensitivity of symptom checker, and what exactly is the path that you're going through those symptom checkers in order to understand exactly what is your current situation. So triage is the beginning of any kind of a discussion and any kind of a conversation that is happening in order to start understanding the current situation you're in. And having the ability to take down the hassle of a human being asking those kind of questions and being able to profile you in the best possible way in order to be able to optimize the decisions that you have to take. So what symptoms checkers are doing at the beginning, it started with a very simple question about where does it hurt? where exactly who you wish to talk with. And it was just basically just the receptionist taking the most basic questions in order to be able to forward you to the right individual that can actually help you. And when we're talking about does it replaces physicians? No, it does not replaces physician at this point. I believe that in a few years, not that far away, symptom checkers will move to be a full observation and then will move to be a full decision making. And I heard one conversation with someone from the FDA that they expect that within the next 5 years, symptoms checkers will move to be also FDA approved. And that means that those kind of symptom checkers with the ability to extract vital signs, and this is the contribution by Bina, those kind of solution will actually be able to take decisions and to actually recommendate whether it's on a specific drug treatment, whether it's on a specific process that the person should go through. But this is, I think, more into the future. When we're thinking about how symptom checkers actually work, so it goes without saying that AI, a lot of people use AI, but eventually we're talking about models that are able to be aligned to a specific individual are being able to take those kind of decisions. So it goes without saying that as much more information that an AI model have, that means that the symptom checker and the kind of recommendation it gives you will be more accurate. And now we see that symptoms checkers will sometimes work only after you log into your NHS systems, which means that they already have your historical information. Configuring a symptom checker to include your historical background dramatically changes the way of what the recommendation and the line of questioning is. So if you had any kind of a lung invasive surgery, goes without saying that the line of questioning should truly focus about your breathing ability, about your relaxation ability, about your pulse rate, and about your blood pressure, as all of those are connected to your historical information. So we see how the AI availability that is connecting with the symptom checker engine at the back dramatically changes the added value if it's actually connected to your historical medical information. So those are things that are actually evolving. Having the ability to have those kind of machine learning algorithms optimize the line of questionings according to our historical data also dramatically changes the effect that it's having on you, also on the length of the questionings they have to get from you. Because if you've already been identified when you start using the symptom checker, questions such as your age, your gender, your biological gender, of course, questions about your historical information, questions about your locations are reduced. And the type of engagement that is required in order to be able to deliver a higher quality of symptoms analysis changes dramatically. And when we're talking about engagement, no doubt that everyone wants to get an answer right away. So I think that an interesting question is also about how long will the process take? How far will a person will be dedicated to a specific user engagement in order to make a better decisions? And those things are evolving very quickly. There's a lot of different architectures and sophisticated mechanisms that are actually built in order to be able also to have the answers that you provide analyzed in the best possible way. If at the past, everyone was sure that NLP will be ideal also for short questions and answers. You know, everything started with tweet analysis, 140 characters at the beginning. It dramatically changes to understand that different types of AI, I'm not going to even call it AI, but different type of analysis architectures are changing in order to optimize the specific questions and answers and how those are actually being analyzed. We can see that when talking about the efficiency of such system, it's not amazing yet. Goes without saying that 2 years ago and 3 years ago, those kind of symptom checkers were actually much, much better. But when it comes to the to the usage of those kind of symptom checkers, we've been able to see that the majority of the symptom checkers today are actually very limited when it comes to the efficiency of having the ability to diagnose in the right way what is the specific observation of a specific person. When we're talking about the usage, whether it's about to determine whether to seek care or where, whether we're talking about get medical advice without going to the doctor, better understand their diagnosis, it's pretty limited when it comes to the efficiency, which stands between 50 to 77%. There was an interesting article that was published just a year ago in July 2021 that tried to measure and to analyze the accuracy of online symptom checkers. Keep in mind that the majority of those symptom checkers is not based on your historical information. They do not have real-time health data that helps them to make a better diagnosis. So this is something that is very limited, and you can see actually from the results that the majority of those kind of symptom checker accuracy was very, very low. So what we've came to an understanding is that you have to have the ability to add additional value. If in the past it was just a few small startups or a few companies that do not have the historical information in order to get to the right diagnosis, we've seen that lately a lot of major organizations from Mayo Clinic to other huge type of hospital chains and networks are adding more and more symptoms checkers in order to be able to get and save time and money. And I think that's actually also improving dramatically the life purpose of a person whenever we're talking about to improve that. So we got a great question by a person. I'm sorry that I'm not mentioning your name, and I'm not sure if it's positive. What is the accuracy of a real doctor? And from the question that we can see here, we're definitely understanding that today that it really depends on the type of doctors and the type of service. For example, radiology doctors. If a person tries to analyze your MRI or CT images, accuracy is between 75 to 85% at best. When we're talking about doctors that actually have 5 minutes with a person, maybe they collect their vital data, maybe they're not. But in those kind of accuracy, we're still talking exactly like your roadster that can be between 60 to 80% at best. So whenever I'm talking in this specific slide that I've entered before about the accuracy of the device, that doesn't mean that those should not exist, as the accuracy of medical physicians today is not much more efficient in the 5 minutes that are actually spending time with the person and actually able to ask those questions, maybe to run a very basic observation or vital signs extraction. So as time passes and we're seeing more and more facilities that are able, and I think this is also directly connected to the inability to have enough manpower to support everyone. Whenever it's the middle of the night and you're not feeling well and you just want to see whether you should go see a doctor or not, and this is the key question, you know, it goes without saying, if each and every one of us had a physician service just below our house, most likely we would just go down the stairs and go see a doctor. But in most cases, it's not like that. So whether we need to see a doctor, whether we can wait a day or two to have a telemedicine session, whether we should actually talk with a professional, dramatically changes if we're able to get a quick diagnosis in order for us to take better decisions. So not only that we're seeing Mayo Clinic, and I think this is something that we're very proud of, GoGetDoc. GoGetDoc is a venture-backed digital health company based out of San Francisco Bay Area, and we're extremely happy to say that we have partnered with GoGetDoc, and we're also available as a vital signs extraction mechanism out of the GoGetDoc symptom checker. So GoGetDoc is a very established company that are able actually to provide you multiple types of observation to multiple types of services. But if you go to their website, you're able to see that inside of their website, they actually also have a vital sign extraction using Bina. So now you can actually measure your vital signs as part of the observation mechanisms that is part of the symptom checker provided by GoGetDoc in the US. GoGetDoc do amazing work, and we are very proud to be able to partner with them because they're definitely changing the way how those kind of symptom checkers are actually being adopted by major organizations, by providers, and it truly changes the way of providers and partners adopting such technology into production. So when we're talking about measuring health parameters, because it dramatically can change the way of how those kind of symptom checkers work, how those kind of processes are actually being optimized, and what is actually being done. So making sure you are able to actually get the accurate vital signs is a crucial part in order to be able to improve the diagnostic. But in today's world, having multiple types of devices available for you. Some people have a wearable device that is available for them. Some people don't have a wearable device. And in this case, it can be pretty tricky when a person just would like to get a diagnosis and he has not been scheduled. Many times when we're talking about people with chronic conditions, those kind of people have medical devices at reach. And those kind of medical devices can be used at any time in order to add those kind of vital signs and vital data to the decision making of the symptoms checkers. From Bina's point of view, what we've been able to see and understand that those kind of devices always have a never-ending friction. Whether we're talking about cost, maintenance, and many times, how can you be sure that those devices that have been in your closet for 7 years are still have a good and decent calibration, are still able to provide you an accurate read, or whether they're efficient enough after all this time that you haven't been using them. And what we've been able to create is actually a software-based solution that can actually run over any device with a camera. More specifically, and probably the most common engagement system is a smartphone. So having the ability to have Bina be part of your decision making, exactly like we've done with GoGetDoc, you're able to actually get all your vital signs extracted in order to take a better decision about the diagnostic process that symptoms checkers are doing. Bina solution is a software only solution that can run over any smartphone with a browser. So whether it's an Android device, an iPhone device, we're able to get the health data. When I'm talking about health data today, we're able to actually extract, sorry about that, extract blood pressure, oxygen saturation, respiration rate. We're able to extract your energy level, your stress level, and everything can be provided just out of a software interaction. As time passes, we're supporting more and more architectures. We already have an amazing integration with smart mirrors, smart fridge devices, and goes without saying, any kind of smartphone and tablets, and also laptops with specific operating system that by using the camera only, we're able to engage and to provide all those kind of reads. A few words about the technology, even though it might look like magic, it's not. The secret sauce of Bina, of what we've been able to provide, is how we're able to extract an extreme high quality signal of a PPG just out of the person's face or out of the person's finger in order to calculate all the different kind of vital data. So what is PPG if you didn't had a chance to read about PPG? Photoplethysmography have been out there since 1937. And I'm not kidding. The first medical paper that was released on PPG was actually released in 1937. And in a very high level, I guess the purpose of PPG is that whenever you're sending a light beam or analyzing a light beam from the skin surface of the person, it can be your hand, it can be your head, it can be your leg, just by analyzing the tiny color changes that are happening in our skin surface, we're able to determine the blood flow behind our skin. And having the ability of extracting a high quality signal of PPG provides you enough information that you can actually extract the data out of the person's skin in order to calculate all the different vital data. Today, Bina's solution works from the face extractions, which means we're analyzing the light reflection intensity that comes from your face skin person back to the camera lens in order to take the right decision. So it's important to say that PPG, not only that have been out there since 1937, but all of the different smart wearables and like Apple Watch, Samsung Watch, Xiaomi Watch, and I can keep on going, use the same PPG technology. The secret sauce of Bina is how we can use off-the-shelf RGB cameras in order to extract a high quality signal that can actually replace those kind of capabilities. About a year ago, we started supporting also finger extraction. And how come finger extraction is also an important part? Finger extraction allows also to people that cannot show their face in public. For example, we have a few customers in Muslim countries. In Muslim countries, some of the women cannot show their face in public, which is, of course, completely respectable. And in this case, if the person will place their finger on the back camera of the device, we will be able to extract the vital data from the finger as well. Another example, if we're talking about a very limited light condition, late at evening or in bed at night, in those kind of conditions, there's just not enough light to see the person's face. So if you place your finger on the back camera and you choose finger-based extraction, we are enabling the torch, the flashlight, and then we have enough light to actually extract information from the person's finger. As time passes, we had to make sure that our technology actually supports the entire Fitzpatrick scale. What we've learned also is that as part of the FDA work that we're doing now, and we believe that very soon we should be FDA approved on a few of the different vital signs, we had to make sure that as part of the clinical work, the entire Fitzpatrick scale was actually part of the clinical work. So Fitzpatrick scale actually is classifying the skin tones from type 1, which is pale white, you can see on the left side of the screen, until type 6, which is deeply pigmented brown and black skin. And besides validating it in the clinical work, we already have huge customers across the board that already integrated Bina work in production. For example, the second largest insurance company in South Africa. We have one of the largest insurance company in Japan, one of the largest insurance company in India, one of the largest insurance company in Korea, one of the largest insurance company in the United States. So we have been able to not only validate it in the clinical work, but we actually have organizations that use Bina technology in production in all of those kind of regions that actually have those kind of population skin tone. So we've been able to validate that. When we're talking about symptom checker, I guess one slide can tell it all. Bina solution is an SDK. You can see on the left side of the screen, we forgot writing SDK, but it's basically an SDK-based delivery, which means organization can actually integrate it inside of their applications. Once it's integrated inside of those applications, you're able to extract health data. When it comes to the symptom checkers, you have three most common use cases. One, self-diagnosis, which means everything that is built in order to take a specific self-diagnosis that helps you actually to move forward. Second, start a triage. Start detecting and understanding what's wrong with a specific person. And the third thing is actually the alignment into a telehealth proposition. If you've been already able to extract those kind of vital points, after the self-diagnosis, you can actually forward them to a telemedicine session. So any kind of a physician can actually have a quick understanding what is the exact situation and the exact understanding. When it comes to a telehealth, there's definitely multiple types of value proposition that Bina's technology can add. For example, you can actually prioritize the call according to the vital data. During the session itself, in a waiting room experience, a person can actually start to do a scan way before the doctor goes online, so the information is there. And another example is actually after the telemedicine session. If the physician already gave a recommendation for the person, maybe get some rest, maybe use a specific treatment, a specific medicine, after the recommendations have already been done, then a person can actually get a quick notification 5 days later, be able to extract their health data and to understand whether he's getting better or he should reschedule a call with a physician. So you have multiple options to optimize and utilize those kind of capabilities in order to provide a better service. So you see at the upper side of the screen, we have a wellness score. And the wellness score, we've actually taken into consideration multiple types of vital data in order to generate a wellness score. And using those kind of capabilities, you can actually have a quick glance about your situation without having the need to understand actually each and every vital data, what does it mean, and how it reflects on your current situation. So the wellness score is actually being calculated on multiple parameters, as you've seen before, and it's providing you a quick overview taking into consideration the multiple vital signs. Goes without saying that this is not a medical decision. This is a wellness score that we can calculate on a spot check, which means a quick check that is being conducted once you're able to extract the vital data out of your face. What else we've been able to see that symptom checkers are starting to take into consideration is actually heart rate variability. So if anyone had experience in the past on understanding heart rate variability, unlike heart rate, which is basically the number of times that your heart beats in a 60-second time frame, which is a minute, unlike heart rate variability measures the variability between your heartbeats. And those are actually called RR intervals. And today's BINA solution can actually extract HRV in a medical grade accuracy. So you can actually go to our website, bina.ai, and under research, you can see the accuracy when we compare BINA solution to a Polar H10 chest strap, which is a one-lead ECG basically. And today we can get the RRI data extracted out of the smartphone, out of your smartphone in a level of accuracy of a Polar H10 chest strap. And why HRV is such an important role? Because using the RRI data, we're actually calculating multiple types of vital data. Today, I'm sorry about the mistake at the deck. You can see that in a sympathetic stress, it's not coming soon, it's already available. So we are providing you also sympathetic stress. We're providing you already the parasympathetic activity. It's not coming soon, it's already in production. That provides you the option to extract this kind of an information. And having the option to know your parasympathetic activity, you can actually also understand your ability to recover from stress. So at BINA's work, we're able to deliver you heart rate variability in an extreme accurate way so you can gain the benefits of HRV. There's few thousands of medical papers that correlate between HRV and multiple types of diagnosis, multiple types of health condition. So this is something we see very interesting that can have actually more and more benefits. As time passes, we're working more and more on our regulatory efforts. I'm very happy to say that we should have a medical device ISO standard approved in the upcoming few weeks. And with that, we're moving forward with the FDA. And if all goes well, by the end of the year, we should have first 2 FDA Class 2 approvals and also CE marked at Class 2A early next year. So from our goal, each and every vital data should be completely approved in the upcoming 12 months. From a go-to-market strategy, and this is something we're very proud of, BINA delivers an SDK, which means you can gain all the benefits of BINA's technology into your own solution in a matter of days. And once you're able to integrate BINA's capabilities, you decide on the use cases and you can optimize actually the added value that is created by BINA in order to be able to extract each and every part of the data that you're interested according to the user journey and according to the use cases that you have aligned as part of the solution itself. So you're not limited with that. So we considered ourselves as an ingredient. And having BINA's technology, you can actually change the type of offering, dramatically enhance customer engagement, and also be able to actually boost your multiple types of services to a much higher quality in a much higher availability across the different type of services you provide today. Something additional that is very important to make sure it's understood is that the information that is generated and extracted from your solution using Binastech, you own 100% of the data. And by owning 100% of the data, you're able to actually make sure that you maintain full privacy, full compliance, no regulatory violation, and you own the entire data just by making sure that everything runs over the edge device. So you own everything and everything is up to the value that you set.